Welcome back. In health news, epilepsy is one of the most common disorders of the nervous system and affects people of all ages, of course, including children. Dr. Szymczak is a neurosurgeon with Spectrum Health's Helen DeVos Children's Hospital, and he's here to talk about managing epilepsy and the importance of their multidisciplinary team when it comes to treatment. That's a big word, doctor. Hello, good morning.
How are you?
Nice to meet you.
Likewise.
Nice to see you. So, epilepsy, I think when people think about epilepsy, for some reason I immediately go to children. I know it hits all ages, but for some reason it always brings up an image in my mind of a child with epilepsy. And what causes that? Do we know?
There's a whole bunch of things that can cause epilepsy. Before we get to the whole topic of epilepsy, actually, we have to think about what is a seizure. And I always think of a seizure in the terms of, you know, kind of when you want to turn the lights on in your home, you want to turn the lights on in the kitchen, but instead of turning the lights on in the kitchen, you end up turning the lights on in the kitchen and perhaps the living room also, and then they flicker. It's like a miswiring. And if that happens over and over again, that's called epilepsy, multiple seizures. So a whole bunch of things can cause epilepsy. Number one, you know, is it something that's been a developmental sort of an issue? Is there a problem within the brain itself? Could it be a tumor, trauma? There's a whole bunch of things. One of the most common things perhaps is a febrile seizure or a fever, very high fever in childhood. So there's numerous things that can cause epilepsy.
Okay, and obviously all of these things are physical. So you'd think, as a doctor, since there's an electrician, if he hears wiring, he knows he may be able to fix that wiring.
That's
so
right.
As a doctor, you feel that you should be able, since it's a physical ailment, that there's got to be some way that you can repair it and you can fix this. So when it comes to epilepsy, what types of effects does this affliction have on the daily lives of children?
And I think this is the actual key question when they say the daily effects. What happens is the child themselves, and I think this is the most important person of all, you know, they have psychosocial effects. They don't want to go outside, they don't want to play. They're very scared of having a seizure in front of all their friends. And with the family themselves, you think of the financial outlay, the grief that you undergo as a parent. Your child is having a seizure. Now, when I say seizure, is it one seizure or is it 100 seizures? And that's certainly, you know, the burden right there. And then sometimes parents think, well, maybe the seizures can go away. Maybe they'll grow out of them. And certainly that's true for some of them, but not all of them. And I think that's where we can perhaps play a role.
And I'm sure that it probably plays a role in the other children, if there are other children in the family who are thinking, this one child is now getting all the attention. I mean, there's so many different factors.
Absolutely.
And you know, you said that some people can actually outgrow these seizures, so it's hard for a parent to know whether they need to have their child looked at. But that's part of your multidisciplinary team. I mean, we're not talking just surgery or non-surgical. Tell me about the team that you have.
So it's a very large team. First of all, when your child has a seizure, the first person you'd probably see is your family physician, your pediatrician, your PCP. And then the child is evaluated. You know, what kind of seizures are there? Are they in fact seizures at all? Then they probably go to a neurologist perhaps, and then you end up discussing, you know, maybe there's some medications that could be useful. And only after a certain while would that ever go to our multidisciplinary team, which is something that I'm involved in. Certainly when you think of multidisciplinary teams, you have the neurologists there, the neurosurgeons. This is what happens at Spectrum Health. You have a whole bunch of people. There's dietitians, we have the epilepsy monitoring unit folks also. So there's a very, very large team that goes and really looks at your child and says, you know, can we help your child? And certainly there's many seizures that are possible or that can happen, and not all of these are amenable to surgery. So this is where we have to evaluate things with like imaging and all these other modalities that we use.
That's got to feel really comforting to parents of children who, if they're just now coming into this, they know there are other parents with children with epilepsy, but they have this team. They have a big support group behind them through your multidisciplinary team. Now, you said some go to surgery, some don't go to surgery. It's not automatic if they're going into the knife.
Absolutely not. And, you know, as I always think to myself, you know, first I'm a father and then I'm a doctor. So if I want to make sure that my kids have the absolute best care they can possibly have, and if that means surgery, then God bless. But if it doesn't, then I want to make sure that I really look at all the possibilities that are available to us. So when you look at options for treatment, number one, you know, you can have maybe we could just monitor these patients and not do anything, medication or otherwise. So many patients get medications, and then finally, a small percentage of these folks can actually go to surgery. With respect to surgery, you know, if your child has a tumor, then the tumor would likely have to come out. If there's a brain malformation that's happened right from the beginning of time, you know, right from the womb, if you will, some of these things need surgical options also. We do have some newer technologies. One of them is laser ablation. We can take a small little probe that basically put into the child's brain and burn that area. Using all our fancy gadgets, our computers, etc., and burn that area and perhaps slow the epilepsy or get rid of it completely. And then finally, we have this other option. If your child is, for example, having 100 seizures a day, and you can just imagine how devastating that could be to a child and the family themselves, obviously. So there's something called the vagal nerve stimulator. You just implant that on the vagus nerve right here, and it sends these continuous pulses, and these pulses may decrease the number of seizures that your child has. So there's a whole spectrum of ideas and options that are available for your child. And I think if we can just decrease the number of seizures, that would be such a wonderful thing for your child. It can help your child, and it can certainly help the family and the people around your child too.
Well, if you're looking for the best care possible, sort of all the incredible new equipment that they have at the neurology or just neurosurgery department. Thank you, Dr. Szymczak. Appreciate the time.
Thank you for your time, my friend.
Excellent. The Pediatric Neurosurgery Department, if you're looking for help, is located at 35 Michigan Street Northeast in Suite 3003. If you're looking for information right now, pick up the phone, 616-267-2570.